Bismillahirrahmanirrahim. Our today's lecture is daycare surgery. First, we need to define what is daycare surgery. Daycare surgery is planned procedures and operations on patients who are admitted and discharged home on the day of their surgery but require some facilities and time for recovery. What this essentially means is that the patient is admitted and then operated, and then on the same day he is discharged and sent home. But considering that the patient also requires some specialized facilities and some hours to recover from his operative procedure. Daycare surgery needs some degree of specialized post-op nursing care. It's not like the patient just walks in, you operate, and then he walks out. He will require some degree of specialized care, and he will also need a few hours of observation at the minimum. At least for 4 to 6 hours the patient has to be kept in the hospital and observed, and these patients are usually admitted in the morning and then operated early and then discharged somewhere in the evening when they are fully recovered. This is different from outpatient surgery. What is outpatient surgery? This is that type of surgery in which you just check a patient. You need minimum investigations. You need to operate him. You don't need anything more than a local anesthesia, and nothing more than a small operation theater with a few instruments. You just admit him. You perform the procedure, and then you discharge him within half an hour, 1 hour at the maximum. But this is different from daycare surgery. In daycare surgery you can use even general anesthesia. You will require a fully functional, fully equipped operation theater. You will require detailed investigations, and you will require a fully manned and equipped recovery room as well. What are the benefits? Obviously, if the patient is not staying in the hospital for long, it will reduce the cost of treatment both for the patient and for the hospital. It is more efficient as far as we consider the working of a hospital, and it reduces the waiting list for elective surgery. If you can just perform the surgery and send the patient home, and on the very next day you can perform a next list, obviously the waiting time for the patients will be reduced. And the inpatient beds, the indoor beds, are available for major elective procedures that may be taking place at a separate place in the same hospital, and those can be monitored for longer periods of time. Daycare surgery, as documented by many researchers, has lower rates of morbidity to the patient, and there is lower incidence of thromboembolism. Thromboembolism is highly related to patient's mobility in postoperative period. So if you're sending a patient home after 6 hours, that means he is fully mobile and he is taking orally, so this will reduce the incidence of thromboembolic phenomena. If the patient isn't staying in the hospital for a longer period of time, his chances of acquiring hospital-acquired infections, nosocomial infections, is reduced to a great extent. The patient will return home early. He will obviously return to his work early, and it will cause very minimal disturbance to his normal routine life. But like all good things, it is also daycare surgery is also related with a few potential problems. Daycare surgery suites require an initial input of a major sum of money. It's not an easy thing to start, but once you've started, then your expenses become less. A daycare surgery suite will require a very good organizer, a very good skilled person, and a proper management team. If the patient selection and the procedure selection is not appropriate, it can have dangerous results. If you haven't given adequate information to your patients, the patient might feel distressed being sent home on the very same day on the day as he is being operated. Morbidity of anesthesia and surgery might sometimes become too much for the patient to be sent home. For example, if you planned a surgery but somehow or the other it became complicated, then you might have to retain the patient for a longer duration of time, more than a few hours, and you might have to give a patient initially, if you had planned like a spinal anesthesia and you had to change it to a general anesthesia, that will increase the morbidity to the patient. And in daycare surgery, the burden of care is eventually transfers to the patient himself and to his attendants and his family, because when he's sent home, he's given a set of guidelines that he has to follow, and how he follows those guidelines depends totally on him, the patient himself and on his family. A good daycare surgery unit should be a self-contained, dedicated unit with its own reception, recovery, and operating areas. It should not be mixed up with other units of the hospital. A good daycare unit should be designed to ensure that all essentials of good daycare surgery and practices are present in that single suite. And it is usually a part of a general hospital. It's not isolated places or small hospitals, but these daycare surgery units are a part of a bigger tertiary care, usually a tertiary care hospital. What else is required? You require a reception and nursing station in a daycare surgery unit. You require an OPD area and separate consultation rooms for individual patients. You require operation theaters, then a pre and a post-op recovery rooms, and obviously you cannot work without a proper lab and a pharmacy available. What other features are desirable for a good daycare surgery unit? It should be a self-contained unit. It should not rely on any other part of the hospital. It should be able to do everything by itself. It should be close to the parking, because when you're going to send a patient home after 6 hours of his surgery, he doesn't need to walk too much to get to his car or whatever conveyance he has. So it should be close to the parking. It should be well laid out with good patient flow. It should be easy for patients to access the daycare surgery suite and then to leave it. The planning should be proper. It should be equipped as similar higher standards as a proper inpatient ward and theater are done. The record keeping should be perfect, because the patient is going to be in contact with the hospital staff for a smaller duration time, and it is easy to miss things in a small duration. Support services like indoor facilities and skilled professionals should also be readily available in case the need arises. Consultant-led anesthesia and surgery, there should be well qualified consultants for both, and the staff should be well trained and well equipped. Patient safety is ensured in daycare surgery by choosing a good patient and by following strict protocols. You may even use computer-aided diagnosis. These things are not very common in our setups, but in the West these are being used commonly. Meticulous record keeping and surgical audit. Surgical audit is something again we lack in our setups. It should be done regularly, at least on a 3-monthly or 6-monthly intervals. In case there are some unfortunate incidents like drug reactions or blood reactions or wrong site surgery on the wrong site, they must be reported. They should not be hidden, and standard of care should be considered as per the local guidelines, and they should be followed. Not all patients and not all procedures are suitable for daycare surgery. If you consider contraindications of daycare surgery, a patient who's an asthmatic, he might need longer duration of stay post-operatively in the hospital, so we do not consider him for daycare surgery. Similarly, if a patient has difficult airway, it's anticipated that he might need respiratory support in post-operative period as well. Patient with known cardiac history, patient who's hypertensive, which hypertension may be leading to cardiomyopathy. If a patient has uncontrolled diabetes, he is more likely to have postoperative wound-related complications. So, again, not suitable for daycare surgery. If a patient is morbidly obese, he is going to require longer and more intensive postoperative care. So, again, not suitable for daycare. And Generally speaking, any procedure which will take more than 90 minutes should not be done in a daycare surgery suite. Success will depend specifically on your patient selection. If you, as it's written in the bill, if you choose well, cut well, it will heal well. If you choose a good patient, everything will go smoothly. If your first step, that is the patient selection, is not appropriate, then you will suffer at every step. Preoperative assessment should be optimal, and the patient should be stabilized or optimized preoperatively. It should not be the patient should not be rushed to the operation theater. The anesthesia should be well planned. The anesthetist should have seen the patient beforehand, and he should have a decision beforehand that what he is going to do with the patient. Uh, Postoperative pain and vomiting are the most commonly presenting complaints in patients in the first 24 hours after surgery. So if you treat these two things well, the patient might be willing to go home early. And extended care should also be available for the patient. If the patient wants to stay in contact with his operating doctor or with a staff nurse or someone, should be able to contact the daycare surgery suite 24 hours anytime. Intelligent patient with a responsible adult with a phone number or an email is an ideal candidate for daycare surgery. When we consider patient selection, we have to consider certain criteria. If we consider patients' health related criteria, we should choose patients who are good candidates for anesthesia. They should not have any difficult airways, they should not have any previous history of complications during anesthesia or things like that. Patient body mass index should be less than 30, shouldn't be morbidly obese. Patient should have a normal airway. There shouldn't be any recent respiratory tract infections. There shouldn't be any history of anesthesia complications of the patient or even in close family members. Younger patients are usually better candidates, and patient should be offered a choice of date if he wants to delay surgery for a few days or if he wants to get it early, because patients need to plan these things. Patient might need to get leaves from his office or from his college or thing like that. So he should be offered a choice of dates as well. Which procedures should be selected? Minimally invasive procedures are ideal for daycare surgery, so we ideally choose those procedures which have minimal physiological alteration involved. Procedures associated with excessive blood loss will require the patient to be kept in post-op recovery for a longer period of time, so we don't usually do that in daycare surgery. And if there is anticipated risk of serious postoperative complications, for example, if we are anticipating that the patient may develop a respiratory issue postoperatively, don't do it on a daycare basis. As stated earlier, duration of surgery should be about 1 hour or 90 minutes. Pain must be controllable with oral analgesics, because not every patient will be able to take an injectable analgesic at home. So if you cannot control the pain with oral analgesics, again, he is not a good candidate for daycare surgery. And patient should be mobilized early. So if you're going to perform a procedure on his leg and you cannot mobilize the patient early enough, don't do it as a daycare procedure. Social criteria is also very important. There should be a responsible adult or supervisor or an attendant at home to take care of that patient. If the patient lives alone, he might not be able to take care of himself properly, and it's not wise to send him home on the same day. Other circumstances that we have to consider: the patient should have any stairs in his home. It's not suitable for a patient who has been operated 6 or 8 hours before to have to go up a flight of stairs of 20 or 24 stairs. Isn't suitable. So patient shouldn't have any stairs at his home, and patient should have suitable toilet facilities at his home. And the patient's home should not be more than 1 hour drive away from the operating area of the daycare suite. Which surgeries, which specialties can perform daycare surgery? General surgeons, they often perform daycare procedures. Orthopedic surgeons, performing procedures on the upper limb or arm or the hand, can be performed as daycare procedures. Gynecological procedures may also be suggested. ENT or ophthalmological procedures, Even some plastic surgical procedures may also be done as daycare procedures. Similarly, urological procedures, minimally invasive procedures in which they do these transurethral procedures, they can be sent home on the same day as well. If we take some examples from general surgery, diagnostic laparoscopies can be done as a daycare procedure. Laparoscopic cholecystectomy, laparoscopic appendectomy, laparoscopic hernioplasty, laparoscopic incisional hernia repairs, all of these can be done as daycare surgeries because if you give adequate analgesia, the physiological alteration isn't much. The patient is usually able to get up and walk around within 6 or 8 hours after surgery. Gastroscopies and colonoscopies are mentioned here as general surgical procedures because in some Western setups these are considered procedures of general surgery and not as a separate specialty of physicians or gastroenterologists. Thyroid lobectomy, if you are removing a small lobe of thyroid, the patient might be able to send home on the same day. Similarly, herniorrhaphies may be sent home on the same day. So how do you plan a daycare surgery list? These lists should be separate from your detailed or major elective surgery list. So you can mix the daycare surgery and short stay surgeries. For example, if you have 4 or 5 procedures, out of which half are to be done under local anesthesia and half are to be done under daycare surgery protocols, that's a suitable arrangement. But it's not a good thing if you want to mix inpatient surgeries with a daycare surgery because they have different requirements and they will create tension for you, for the surgeon and for the team as a whole. How should the list be arranged? Major cases should always be done first so that they have adequate post-operative time of observation in the hospital. Diabetics are obviously done early because you cannot keep them in PO for very long. Minor cases or cases which are to be done under local anesthesia should be kept to at the end of the list because they don't need long duration of post-operative care. You might be able to send a patient home after half an hour, 1 hour. So if you operate him something around 12 or 1 p.m. and you can send him home around 3 or 4 p.m., it's fine. What to do about post-op nausea and vomiting? Because as I already said, pain and vomiting, these are the most common complaints in the first 24 hours after surgery. So if the patient has post-operative nausea and vomiting which is not responding to treatment, you might consider keeping him and place him in an inpatient ward and not to send him home on the same day. Nitrous oxide is associated with nausea and vomiting in the post-operative period. So if you're planning a daycare surgery, don't use nitrous oxide. Propofol is always considered to be better. Opioids, any type of opioid will cause some degree of nausea. So if you consider the patient a good candidate to be sent home, try to give analgesics in the form of NSAIDs rather than opioids. And metoclopramide, Maxolon, commonly used in our setups, is again good for nausea and vomiting, and even sometimes steroids may be given to prevent or treat nausea. When to discharge a patient? When he is stable vitally, when he is fully oriented and he is talking and he is moving around, he is able to take oral diet and doesn't have any uncontrolled pain, there isn't any nausea or vomiting, and you've checked the dressing, there's no active bleed, you have confirmed that the patient has a responsible adult at home who can take care of the patient, and before discharging the patient, the hospital needs to take an emergency contact number from the patient, and the patient needs to take contact information of the hospital as well, so that in case any emergency arises, both parties should be able to contact each other. The discharge area should be fully equipped to use standards with trained staff. This is usually a nurse-led discharge. Consultants or a physician is usually not involved. When the nurse is fairly confident the patient is fine and he can be sent home, she can do so. This actually allows the potential for rapid turnover of the patients. You don't keep the patient for too long. The next day your daycare suite is ready for a new list of patients. Patient's discharge should be supported by appropriate documentation in patient information handouts. The patient should be given detailed information about his procedure and what to expect in his post-operative recovery period, so that there are no surprises for him. And when and how to recall, this should be made very clear to the patient. The patient should be given a 24-hour contact number in case if he has any problems or if some emergency arises. He should be able to contact an emergency contact number in the hospital at any time during the day. And danger signs should be explained to the patient and his attendant or his family member who is going to take care of him, so that if any of those signs develop, the patient should be immediately brought back, or at least they should contact the medical staff. This was all about daycare surgery. Thank you.